Every year, the World Health Day is celebrated on April 7 as a Global Health Awareness Day under the sponsorship of the World Health Organization, WHO. The day celebrates the establishment of the WHO, and this year it marks the end of the World Health Organization's 70th anniversary celebrations. Universal health means that all people across the globe have access without any kind of discrimination to comprehensive quality services wherever they need them without facing financial difficulties. In marking the day, the World Health Organization have put together a mini play let on how people across the globe have access to basic health.
Ben's not doing well. Did you manage to get the medicine?
No, they didn't have any.
I'm sorry you're feeling so horrible, my darling.
And how much is it going to cost? Are you sure? Just for an appointment. What if we don't have the money?
Mom, Ben needs help.
Tom, we're gonna have to get a taxi.
Well, we have live in the studio with us Dr. Yusuf Alienna. She is a medical practitioner and she's going to be throwing more light on this year's celebration. It's good to have you join us.
Thank you so much.
I also know that you're a family doctor and, of course, you're a nutritionist, so you are an all-rounder. You can tell us a lot about health. But, of course, this year is a continuation of last year's theme, which is universal health coverage. Yes. So I'm just wondering, in Nigeria, looking at our budgets and how much we allocate to medical care, health care, is it anywhere scratching the surface as to what the United Nations has recommended?
Not at all. It's far, far below expected. Because if you look at this universal health coverage, it's talking about taking health to everyone, everywhere. Whether you are in the rural area, you are in the urban area, rich or poor, young or old, educated or not educated, female, males, they should have health services which is affordable, available, accessible, and acceptable.
Before we even get to the part where we talk about it being affordable, is it available? When I was growing up, at least for every area, there was a medical center. There was how they called them, health centers. Yes, primary health care. But today, those places are disappearing, and one would wonder, is our health sector deteriorating? Is it going from bad to worse? Because in the 21st century, where all kinds of things have been introduced to Medicare, technology, and all of that, why should we be on the low? I
won't actually say it's disappearing. It's actually still there, but the decadence is really so much because infrastructures are not being maintained. There are newer innovations to health. All these facilities that we need for new innovations are not available. They are not put into those facilities. The primary health care are still very there. The primary health centers are still very much available. In fact, newer ones are built every day, just that the population is escalating. But
we see more people going to the tertiary medical centers, talking about the Luth or the likes of it, instead of making use of these medical centers. Now, you have said that the population is exploding, and of course the centers are not well equipped. As a medical practitioner, what is the NMA doing as a body to push these problems to the federal government through the Ministry of Health?
That is why there's this World Health Day, is to create awareness for all these global health concerns. It's a serious problem that we are still struggling with. We as NMA is still struggling with it. anytime they read the budget, you find that the medical sector, the health sector, educational sector, they still lag behind. And they always come up to argue with them as in this thing you have budgeted is nowhere going to take care of what we need to rehabilitate these health facilities. It's a problem. They are working on it and they will still work on it.
Quickly, before we move on to other issues, let's talk about the fact that there have been outbreaks of, we've had, I think, cholera at some point.
Cholera,
Lassa fever, which has refused to go anywhere.
Yeah.
Thank goodness we were able to kick Ebola. Do we have the same concerted efforts put in place when it comes to fighting these other breakouts? Because I'm guessing if we have great health care, we must have been able to kick it out, long ago. And how educated or how much education and awareness are we taking to those rural areas, especially places where those outbreaks are more?
Yeah, that's why you see there's more focus on the primary health care now, because that's what takes health to the grassroots, to the communities. And most of all these problems, they come from the remote communities. So there's more focus on the primary health care. If you go around all the facilities, you see they are making more efforts to make sure these facilities are up and doing, to be able to, this is where the community people get to before they get to those tertiary institutions. This is where they get the education they need about all this outbreak, because good education is what is really going to alleviate the problems we have right now with all this outbreak.
And finally, how well is the relationship of the NMA and the media? Because when I was a little girl, I learned about family planning when I was in secondary school because of the adverts, the jingles, the songs, those. Do we still have those partnerships with, take, for example, Society for Family Health, or let's say, community medicine and the media to educate, to go to marketplaces, give flyers? We don't have to wait for them to come to medical centers, because there are people who are too scared to come to hospitals because they think that there'll be too much money being asked from them.
Yeah, I always say it's better now because of widespread social media.
But how many people are on social media, especially the people you want to reach and give that education to?
Well, averagely, I think it's okay. It's okay. Awareness is better now compared to then that you are talking about. I think there's better awareness now because a lot of things we now get to read, others read, and they disseminate the information. That's a good thing about social media. And those that are not on social media, they get information from neighbors, they get all these educations from people who go there to actively read what's going on. Awareness is getting better. I won't say that. Though I noticed that all those jingles are really no more on...
We don't hear them anymore.
Yes, on television. I think what they feel is people now go on their own to go and find out information. People are getting more aware now.
Okay.
Because I've seen old women who come to my clinic, by the time they are talking about diabetes, I like, how? How did you get to know? So my daughter was reading it to me, So awareness is still... That's
interesting. As we celebrate this World Health Day, what should be our focus? What should be our watchword for every single person who's watching?
There should be awareness about all these global health concerns. And for this universal health to be covered everywhere, the political leaders, they need to come into it. They need to take it more serious, because there's no way we can actualize this universal health coverage for everyone, everywhere, without a strong political will. And that's why WHO is calling on the world leaders to try and make this thing a reality, because for the past 70 years, they've been on it. They've been talking about these universal health coverage for everyone, everywhere. But it's so disheartening that we are still where we are. In fact, it's getting worse because millions are now being pushed into poverty, trying to pay out of their pockets for health services provided for them.
Well, it's quite unfortunate, but we want to say thank you to you, Dr. Yusuf Alienna, medical practitioner, for speaking with us. We appreciate it.
Thank you so much.
All right.